It is 7:18 at 97.3 FM WVLK, and Dr. Kevin Kavanagh joins us now. He is founder of Health Watch USA, a retired physician himself. And bring us up to speed here, Dr. Kavanagh. I understand 28 cases in Kentucky?
Yes, we have now 163 cases total, 4 deaths. There's 14 new cases in Fayette County. If you go to the health department's website, we have a curve that is just going almost straight up, and so we are getting into the peak of this epidemic, which hopefully will be very, very short-lived. I think the governor is doing an excellent job on social distancing. We need to stay at home. That will blunt the peak, make it come possibly sooner and be lower, and that will be excellent. I just hope that if Kentuckians all do this and we get through this, that other states that are not as compliant will not start a second wave of this virus in our states. But it is very important to get our healthcare system up and running and fully staffed and fully stocked with equipment before we go back into the public.
President last night, as you well know, indicated that he would like to see easing of the guidelines on social distancing by Easter, which is April 12th, which is just around the corner. Is that too optimistic in your opinion?
I think he's being very optimistic. You know, he is under an enormous amount of stress. I think he wants this to go away sooner than it can. We have to ease restrictions when the healthcare system is ready to take care of patients. And we got ourselves into a hole with our healthcare system infrastructure. We have to hurry up and get out of that hole. So if you do get sick and you go into the healthcare system, you have someone to take care of you. Because supportive care is very important. When you hear these low death rates and optimistic statements about getting sick with COVID-19, you have to remember that is with a health department that is giving you supportive care. Even the young, we know now, can get severely sick. And as I said last week, and is now Sanjay Gupta, Dr. Gupta is now saying that those that survive a intensive care episode and you have to be on a ventilator, you may get lung damage. So you do not want to get this viral infection.
The World Health Organization said yesterday that the United States could become the next new coronavirus outbreak epicenter due to the large acceleration in cases. Is that believable to you?
Yes. New Orleans, because of Mardi Gras, again, ignored social isolation, has one of the highest, if not the highest, rates of increase in the world. New York is right behind them. And what's going on in New York is something we pray does not happen here.
So, in conclusion, just keep the distancing, stay at home if you possibly can, and what other tidbits of information do we have?
Stay home, stay safe, get on social media, talk to people. The world is not coming to an end. Mankind has lived through these epidemics throughout the eons. I mean, we need to keep a positive attitude and talk to people, order your groceries and have them delivered. Be very careful about going to the grocery store because social distancing there is very hard. And for me, I'm letting my groceries be non-perishables and sit out for at least 3 days, because that seems to be the guidance that most people is given as far as how long that virus can live.
Good information, and we appreciate you. You will be back with us at 9:30 on Friday morning, and we'll be giving our audience at that point an opportunity to ask questions of you. And thank you very much.
Oh, thank you, Jack.
That's Dr. Kevin Kavanagh, founder and president of Health Watch USA.